Welcome, future nurses. We are officially kicking off our 30-day NCLEX training program, your ultimate guide to mastering the NCLEX, one powerful day at a time. In this series, we'll dive deep into 100 high-yield NCLEX topics and break down 1,000 of the most important NCLEX-style questions across 100 value-packed episodes. So, stay with us for the next 30 days, watch all 100 videos, and build strong command over every key area you need to pass the NCLEX with confidence. Today, we're starting with one of the foundational topics every nurse must know: ethical principles in nursing. Ethical principles in nursing are the core guidelines that help nurses make the right decisions when caring for patients. Let's begin with autonomy. This means respecting a patient's right to make their own healthcare decisions. For instance, if a terminally ill client chooses to stop treatment and enter hospice care, even though the family disagrees, it's the nurse's job to support the patient's choice. On the NCLEX, this often shows up as a scenario where you need to choose the action that respects a patient's right to refuse care or treatment. Next is beneficence, which means doing good or promoting the well-being of your patient. Let's say your patient is post-surgery and in pain. Administering prescribed pain medication on time to ensure their comfort is an act of beneficence. On the exam, look for options where the nurse takes proactive steps to improve a patient's outcome. Then we have nonmaleficence, which is the principle of do no harm. Suppose a nurse catches a medication error before administering it. By holding the dose and notifying the provider, the nurse is preventing harm. On the NCLEX, this might show up as a question about unsafe medications, outdated orders, or contraindicated treatments. And your job is to choose the answer that prevents patient harm. Justice is about fairness and equality in care. Let's say you are assigned two patients, one with private insurance and one without. Justice means providing both with the same standard of care, regardless of their background. In NCLEX questions, this shows up when you're asked to prioritize fairness or distribute care without bias. Now we come to fidelity, which means loyalty and keeping your promises. If you tell your patient, "I'll be back in 10 minutes with your test results," and you actually return within that time frame, you're demonstrating fidelity. The NCLEX might ask about maintaining trust, honoring confidentiality, or fulfilling nursing commitments. And finally, veracity or truth-telling. Nurses must always give patients honest, accurate information. For example, if a patient asks, "Is this test result serious?" and the nurse knows the result indicates a critical finding, the nurse must respond truthfully while using therapeutic communication. On the NCLEX, questions on veracity often involve breaking bad news, discussing diagnoses, or clarifying misunderstandings. So always choose the honest and compassionate response. Now, keep this in mind. The NCLEX loves to test ethical dilemmas where two principles conflict. Say a competent patient refuses a blood transfusion due to religious beliefs. Autonomy says respect the refusal, but beneficence and nonmaleficence urge you to save their life. Which do you choose? The answer is autonomy, because competent adults have the right to refuse treatment, even if it leads to harm. So as you study, remember these 6 pillars: autonomy, beneficence, nonmaleficence, justice, fidelity, and veracity. They aren't just theory. They're the heart of safe and ethical nursing care. And yes, they will show up on your NCLEX exam, so make sure you're ready to recognize them and apply them in real patient situations. Now we will discuss most important NCLEX-style questions related to this topic. Let's begin. Question 1. A terminally ill client with end-stage heart failure chooses to stop all life-sustaining treatments, including medications and oxygen. Meanwhile, the client's family insists that the nurse continue care until the very end. In this emotionally charged situation, what is the nurse's best response? Let's review the options carefully. A. I will explain to the client that the family wishes for treatment to continue. B. As the family, you have the legal right to make decisions when the client is critically ill. C. I will continue the prescribed treatments until the physician gives a new order. D. I understand this is difficult, but I must honor the client's decision to refuse treatment. Now let's break down the rationale behind each option. Option D is correct because it directly supports the ethical principle of autonomy. A competent adult has the right to make decisions about their own body and treatment, even if those decisions go against what the family or care team believes is best. Option A is incorrect because trying to influence the client's decision based on family pressure undermines their right to self-determination. Option B is misleading. Unless the client is incapacitated, the family has no legal authority to override their wishes. Option C is also inappropriate, as continuing treatment without consent is both ethically and legally unacceptable. Question 2. Next, let's shift our focus to Question 2. A client recovering from abdominal surgery expresses hesitation about getting out of bed due to pain. In this situation, which nursing action best demonstrates the principle of beneficence? Here are your choices. A. Administering pain medication and assisting the client with ambulation. B. Respecting the client's refusal to ambulate without further discussion. C. Requesting a physical therapist to handle all mobility activities. D. Encouraging the client to stay in bed until they feel ready to walk. Let's explore the rationale for each response. Option A is correct because administering pain relief and then encouraging early ambulation is a classic example of beneficence, actively promoting recovery, preventing complications, and addressing patient comfort. Option B, while it respects autonomy, does not fulfill the nurse's duty to promote health and function. Option C shows inappropriate delegation. While teamwork is important, avoiding a hands-on role in essential care does not align with beneficence. Option D delays necessary care, which can increase the risk of adverse outcomes like pneumonia or blood clots. Moving on, let's talk about question 3. A nurse preparing to administer an injection notices that the pre-filled syringe is expired by 1 day. The charge nurse dismissively says, "It's fine, just give it." What should the nurse do in this situation? Consider the following options. A. Administer the medication as instructed. B. Notify the pharmacy for a replacement but give the expired dose now. C. Withhold the medication and report the incident to the supervisor. D. Relabel the syringe and continue with administration. Let's walk through the rationale. Option C is correct because it aligns directly with non-maleficence, avoiding harm. Even a 1-day expired medication can carry risks, and administering it would be negligent. Reporting the issue is the safest and most ethical action. Option A is wrong because just following orders doesn't excuse putting patients at risk. Nurses are legally and ethically responsible for their own practice. Option B is still harmful. Notifying the pharmacy is good, but giving the expired dose is not. Option D involves falsifying documentation, which is unethical, dangerous, and could lead to disciplinary action or license loss. Now let's look at question 4. 2 patients walk into the emergency department at the same time. One is homeless and has a high fever, while the other is a well-dressed businessman with a sprained ankle. Both request to be seen immediately. In this situation, what should the triage nurse do? Here are the options you need to consider. A. See the businessman first to prevent dissatisfaction. B. Triage both based on clinical urgency, not social status. C. Treat the patient who is more cooperative first. Doctor, ask the physician to decide who should be seen first. Now, let's examine the reasoning behind each answer. Option B is correct because justice in nursing means distributing care based on need, not income, appearance, or background. A fever in a vulnerable patient may signal sepsis, which is more urgent than a stable ankle injury. Option A is unethical. Prioritizing based on perceived importance or social rank goes against everything nursing stands for. Option C is also biased. Cooperation should never override medical urgency. Option D is incorrect because triage is a core nursing responsibility. Deferring to the physician delays care and shows a lack of confidence in your role. Here is question number 5. A nurse tells a client, "I'll be back in 15 minutes with your lab results." However, 30 minutes pass and the nurse still has not returned. Based on this situation, which ethical principle has the nurse violated? Choose from the following options. A. Veracity. B. Fidelity. C. Justice. D. Autonomy. Let's break down the rationale together. Option B is correct because fidelity means following through on what you say and being reliable. Even a seemingly small promise like returning with lab results is important for patient trust and safety. Option A, while related to truthfulness, does not directly apply here since no false statement was made. Option C and D do not apply because this situation is not about fairness or patient choice, it's about dependability. Let's now turn to question number 6. A nurse receives a call from the lab confirming that a patient's biopsy result is positive for cancer. Moments later, the patient looks at the nurse and asks, "Do you have the result yet?" In this moment of clinical sensitivity, what is the most appropriate response? Let's explore the possible responses one by one. A. I cannot share that with you at the moment. B. Yes, the results are in. Let me have the physician come speak with you about them. C. Your result is concerning, but it's best not to worry yet. D. Let's wait until your family arrives before we talk. Now, let's walk through the rationale behind these options. Option B is correct because it upholds the principle of veracity, providing honest information to the patient while also recognizing the nurse's legal and professional boundaries. Nurses cannot interpret diagnostic results, but they must not lie or withhold the existence of such results. This response maintains honesty and ensures that the physician is brought in for the official discussion. Option A is incorrect because it implies secrecy and avoidance, which undermines patient trust and violates veracity. Option C is misleading. Describing the result as concerning constitutes interpretation, which the nurse is not authorized to do. It may also cause undue fear or confusion. Option D inappropriately delays the patient's right to timely and truthful information, implying that the presence of family is a prerequisite for honesty. Let's move to question number 7. A 55-year-old client recently diagnosed with colon cancer refuses surgery and instead opts to pursue holistic and herbal remedies. The healthcare team believes surgery would be life-saving. What is the nurse's best response in this ethically complex situation? Review these options carefully. A. Convince the client to reconsider surgery by discussing the risks of refusing treatment. B. Respect the client's decision and notify the healthcare provider. C. Schedule the surgery and inform the client later once pre-op is complete. Delay documentation to give the client more time to change their mind. Let's break down the ethical implications of each response. Option B is correct because it demonstrates respect for autonomy. A competent adult has the legal and moral right to choose or refuse treatment, even if that decision may lead to harm or death. The nurse must honor the patient's decision and inform the healthcare provider. Option A may seem helpful, but trying to persuade or pressure the patient undermines autonomy and borders on coercion. Option C is completely unethical and legally indefensible. Proceeding with a surgery without informed consent is a violation of basic patient rights. Option D is also incorrect. Documentation must always be timely and accurate, regardless of whether the nurse agrees with the patient's decision. Here is question 8. A client with human immunodeficiency virus is admitted to the hospital. During the visit, the client's spouse pulls the nurse aside and asks privately, "Can you tell me if my partner has tested positive?" What is the most appropriate response by the nurse? Here are the choices to consider. A. I can share that information only with close family members like you. B. You're the spouse, so yes, you have a right to know. C. I'm sorry, but I cannot disclose that information without the patient's consent. D. Let me check if the physician has already discussed it with you. Let's now discuss why only one of these options is ethically and legally correct. Option C is correct because it honors the principle of fidelity, being loyal to the patient's confidentiality, and follows legal guidelines such as HIPAA. Protected health information, especially sensitive diagnoses like HIV, cannot be disclosed to anyone, including a spouse, without the patient's explicit consent. Option A is incorrect because close family member status does not override confidentiality protections. Option B is legally and ethically wrong. Spouses do not automatically have access to private medical information unless the patient authorizes it. Option D deflects the issue and may suggest that the nurse is avoiding accountability or might share the information later, which further undermines trust. Let's discuss question number 9. During a mass casualty disaster, a nurse has only one dose of a life-saving medication available. However, 3 patients are in critical condition and could potentially benefit from it. Which ethical principle should guide the nurse's decision-making? Evaluate these options closely. A. Veracity. B. Fidelity. C. Justice. D. Beneficence. Now, let's understand which principle takes priority in this scenario. Option C is correct because justice refers to the fair and equitable allocation of limited resources. In disaster scenarios, nurses must use triage systems to determine who has the highest likelihood of survival and who would benefit most from treatment. Option A, although related to honesty, does not apply to how care is distributed. Option B focuses on loyalty and promises, but it does not help in deciding who receives limited resources. Option D, while connected to doing good, beneficence, does not resolve how to fairly divide care among multiple patients in need. Justice is the guiding principle in those moments. Moving to the last question. A nurse accidentally administers the wrong dose of insulin to a diabetic client. Fortunately, the client's blood sugar remains stable and no immediate harm occurs. What is the nurse's best next step? Let's look at the possible actions. A. Avoid documenting the incident since no harm was caused. B. Notify the provider and document the error in a personal note only. C. Immediately report the error, document it factually, and monitor the client closely. D. Inform the patient about the error only if symptoms appear later. Now, let's break down the ethical reasoning behind these choices. Option C is correct because it demonstrates veracity, truth-telling, non-maleficence, preventing harm, and fidelity, professional responsibility. Even if the error caused no immediate harm, it still must be reported through official channels, documented in the client's chart, and disclosed appropriately. This protects the patient and ensures accountability. Option A is completely unethical. Failing to document an error, even one with no adverse outcome, is a legal violation. Option B is insufficient because a personal note is not part of the official medical record and does not fulfill documentation standards. Option D is dishonest. Delaying disclosure until a problem arises denies the patient's right to know about their own care. That's all for today. This was just 1 out of 100 must-know NCLEX topics. Stay with us for the next 30 days and watch all 100 videos to master every key concept and crush your NCLEX exam. See you in the next one.